Hello, I'm Lauren Bojarski. I am a memory care specialist here at the Sanders Brown Center on Aging, and I'm here to talk to you today about the PAINAD scale. The scale is an assessment tool that we use to evaluate those with advanced dementia who may not be able to tell us that they're in pain. So in the next few clips and videos, you'll see some observable behaviors and how to score them so that you can take the best care of your patients. Fortunately, this also helps with our JACO accreditation, and compliance with these measures help with UK Enterprise, so you're helping us out quite a bit and taking the best care of your patients. So in observing the patient for 5 minutes, we score her breathing at a 0. She has normal breathing, which is characterized by effortless, quiet, rhythmic, smooth respirations. She has no vocalizations, leading her to score a 0 for this as well. She has a neutral or pleasant quality if she does speak at all, but she doesn't in this video. For facial expressions, she is smiling or inexpressive. She's neutral, she's at ease, relaxed, and she has a score of 0 for the facial expression. For body language, she is relaxed, she is calm, restful, mellow appearance. The person seems to be taking it easy, therefore gets a 0. And she has no need for consoling. She has a general sense of well-being, and she appears content, so she scores a 0 for consolability as well. Good morning, Miss Marie. How are you doing today?
I'm doing well.
I'm glad to hear it. How are you feeling?
I feel fine.
Good, good. Any pain anywhere?
No.
Wonderful. Okay. Well, I just talked to your family last night. I was just updating them on your care. They're going to come and talk to you today. They'll come and visit you. I know you love seeing them.
I do.
Yep.
I want to go home.
Oh, I know. We want you home too. We want you safe in your bed.
Yeah.
But we got to get you home safely. So we're just going to take a couple labs and we'll get you out as soon as it's safe.
Okay.
All right. I just have a couple silly questions though. Can you tell me what year it is?
2025.
Excellent. Very good. And what month is it?
Well, it's been a while. I think February.
Very good. Very good. Well, that's all the questions that I had for you today. It looks like you're doing really well. It was lovely to see you, Miss Marie. I'll see you in a little bit, okay?
Okay.
So after observing this patient for 5 minutes, we notice that her breathing is occasionally labored, which is characterized by episodic bursts of harsh or difficult respirations. She also sometimes has short periods of hyperventilation, which is characterized by intervals of rapid deep breaths lasting a short period of time. And for this reason, she scores a 1 for breathing. For negative vocalizations, she has occasional moaning or groaning. She also has a low level of speech with a negative or disapproving quality as seen in the next clip, which is characterized by muttering, mumbling, whining, grumbling, or swearing in a low volume with a sarcastic or complaining tone. For this, she scores a 1. Her facial expression is sad, frightened. She seems to be frowning, for which, again, she scores a 1. Her body language is a bit tense. She seems distressed and has some fidgeting. And again, for body language, she scores a 1. You'll see in the next clip that she is distracted and reassured by voice and touch. So for this reason, she is consolable and scores a 1. Good morning, Miss Marie. How are you doing today?
Not good.
Not good. Can you tell me what's wrong?
I'm not good.
Okay. Well, how did you sleep last night? Did you sleep okay? Okay. Well, you know, I did talk to your family yesterday.
Where are they?
Well, they're at home. They were sleeping overnight, but I told them that you were here in the hospital, so they know exactly where you are, and they're coming to see you today.
Well, they need to get here.
I hear you. They'll be here in the afternoon, and we'll see what we can do to get you home safely, okay?
Well, I need to be home.
I agree. We want to get you out of here as soon as we can. And you're sure you're not in any pain anywhere?
I just want to go home.
You just want to go home. Okay, well, I understand. Let me go get some labs and some paperwork for you, okay?
Okay.
I'll check on you later. So in observing this patient for 5 minutes, we notice that she has noisy, labored breathing. This is characterized by negative sounding respirations on inspiration or expiration. They're usually loud, gurgling, wheezing, and can appear strenuous or wearing. She also has long periods of hyperventilation. This is characterized by an excessive rate and depth of respirations lasting a considerable time. Between these two behaviors, she scores a 2. Vocalizations are clear that she has trouble in calling out. She has loud moaning or growling and appears to be crying. These all earn her a score of 2 for negative vocalization. She clearly has facial grimacing with eyes closed, and for facial expression, she earns a score of 2. Her body language is very rigid. Her fists are clenched, her knees are pulled up. She's pulling or pushing away, as seen here along the bed, and she does strike out when someone comes to the bedside to try and console her. For these reasons, she earns a behavior score in body language of 2. For consolability behaviors, she is unable to be soothed by any people coming to the bedside to stop a behavior with words or actions. There is no amount of comforting, verbal or physical, that will alleviate this behavior, and so she earns a score of 2 for consolability.
Good morning, Miss Marie. How are you doing today? Hey, are you okay? What's wrong?
Help me.
Can you tell me what's wrong?
Help me. Help me.
You're in the hospital. You're very sick. We're trying to take care of you.
Help me. Help me.
You know, I talked to your family yesterday. They're on their way here. Yeah.
No.
Okay, Miss Marie.
No.
Your family's going to be here this afternoon to see ya.
Help me.
Okay. I'm going to go talk to the...
Help me.
I'm going to go get you some medicine
Help me.
to help you.
Help me.
Yes, ma'am. Yes, ma'am. I will. I'll come by in a little bit to check on you, okay?
So in the clips that you've just seen, there are observable behaviors that you can rate from a 0 to a 1 or a 2. And they can be mixed and matched. Some can be 0, some can be 1. A possible interpretation of these scores is something from a 0 to a 10 scale. Anywhere from a 1 to 3 could be considered mild pain, anything from a 4 to a 6 could be considered moderate pain, and anything from a 7 to a 10 could be considered severe pain. And all of these could be even considered amenable to analgesics, all to help you take the best care of your patients. Thank you for watching this video.